All right, good morning, everyone. Happy November. Congratulations on finding a parking space. I think that sometimes creates a challenge, but thank you for being here. So you can see our agenda and call our meeting to order. And now let's do our roll call.
Okay, push the button that's wrong, like. Get back to the button. All right, Eddie Mesh,
Here.
Ashley Jackson, here, Dr. Fuller,
Here.
Dr. O'Rourke, Tommy Smith,
Here.
Nikki Norton, Desiree Thomas, present, Dawn Harris, Dr. Jabasis, Dr. Bryant, Gina Doucette here, Dr. McLean,
Present.
Beth Alford here, Kenny Herbold,
Here.
Dr. Gladden,
Here.
Trey Roche,
Here.
Dr. Palermo, Dr. Tyrone,
Here.
Dr. Cassidy, Keith Williams. Have a quorum.
Thank you very much. All right, next item on the agenda is approval of the minutes. You have the minutes in your packet for your review.
I just would like to take this moment to apologize again. I had Wi-Fi issues in case y'all weren't hearing. I did not have Wi-Fi when I thought I had Wi-Fi. My hotspot was on. I thought it was sent. So my apologies for not checking up to make sure this was sent earlier to now.
Thank you.
Oh, no, again, apologies.
We'll entertain a motion. I move to approve. Dr. Gladden move. Gina second. Any opposed? Okay, the minutes are approved. And we are going to move right into the next agenda item, the presentation of the return to work recommendations and the work that task force is going to take, correct?
Yes, so Catherine is here. Catherine Whitney, who is the executive director of TRSL, is here to do a brief presentation on return to work recommendations, which may have some impact on our discussion today. So,
are we sit here? Are y'all expecting Harris or that end?
we are definitely not expecting Dr. Palermo. So if you'd like to, and Ms. Harris won't make it either. So either one is open for you. All right.
Good morning.
Good morning. Good morning.
Thank you all for having us here today. And as Elizabeth said, I'm going to work through some of the return to work study group, SSR #1 by Senator Price asked for a group of stakeholders to look at TRSL's return to work law. And because it relates to some of the discussions you all are having, it may have an impact or maybe something that for you to be aware of as you think about phased retirement. I'm here to work through the preliminary recommendations at this point. From a timeline perspective, the draft is still in the works right now. We're about to get the draft report out, expect to get it to Senator Price, hopefully by the end of this month. So those of you in the higher ed community, higher ed does not utilize return to work for their TRSL retirees quite as much as K-12 does. So this is a hot topic. We have had a return to work law since the 1950s. Most public retirement systems around the country have a return to work law, and that is restrictions on retirees from returning to work and being able to receive a benefit while they return to work, a full benefit. And the reason for that is because that can have some actuarial costs depending upon how it's structured. So it's something that the legislature is always very vigilant over. So what we've seen is a lot of a restrictive policy and then an open policy over that period of time. And if we go to the next slide, and I'm not going to go through this, I promise, but when you look at this slide, you see a lot of complexity in the return to work provisions. So this is partly, part of the reason why Senator Price asked that we take a look at this and see if we could simplify this and come up with a number of options that really creates balance. When we talk about return to work, it's always about balance. It's providing retirees with options. It's providing employers with the ability to fill vacancies, and particularly on the K-12 front, we've seen a lot of vacancies from a certified teacher perspective, but at the same time measuring such that it doesn't have a tremendous cost for the defined benefit plan, which of course in turn goes to the employers. So this gives you a picture of what we look like today. So I'm going to jump right into the recommendations for changes, retention of some provisions, but changes in this law. And I'll zero in on some of the items that are probably most pertinent to you all. So there's a few pieces that will be retained from the current law. 12-month waiting period, this is the one I'll focus on. That is in place because it helps with some of the larger actuarial costs. So just very, very briefly, anytime you have a law that allows people to receive both their full earnings as well as their retirement benefit, they're going to take that option. So what this 12-month waiting period does, it doesn't prevent people from being reemployed, but it does prevent you from receiving your retirement benefit if you're reemployed within those first 12 months. So what that provision does is help curb some of the larger actuarial costs that are always come up when you talk about a return to work structure. So that will remain, and that protection allows us to do the other pieces that are being recommended within this proposal. There's a grandfather group among the many changes, which again, I'm not going to go through. A big change in 2010, basically grandfathered a number of retirees that don't have any restrictions once they return. That's going to stay in place. We're going to recognize that group. And then there's another provision that was added in 2020 that will also remain. And this allows TRSL retirees who, when they go back to work, to choose an option that allows them to suspend their benefit and then earn a supplemental benefit for the period of time in which they are reemployed. And when they ultimately retire, they receive that original base benefit and then a supplement based on that subsequent work. So that's going to remain. If we go to the next slide. So this is the heart of the proposals in terms of changes. So currently TRSL has a law and it's different for when you retired. So that's going to go away. The categories of 2010, 2020 separates retirees. All of that's going to go away. But there is currently an earnings limit of when you return to work, what your earnings can be. When you exceed those earnings, that's when you would be subject to a benefit suspension and or repayment if you continue to work. So currently it's 25%. It's measured on two different numbers, and this would move it to 50% of an individual's final average compensation. And the final average compensation are really your highest 3 or 5 years that are used to calculate your benefit. That's relevant because there are some earnings limit that relate to your retirement benefit, which if you had lower service could be lower. If you choose an option where your spouse gets part of your benefit could be lower. So when you look at your final average salary, that's for the most part almost always going to be a higher number upon which that earnings limit is based. So this would raise the limit from 25 to 50% and have it based on that final average salary, those highest 3 or 5 years. So that's the first big proposal, first big change. If we go to the next slide. So this is a new provision. And again, part of the goal of this work group is to simplify these provisions as much as possible. But when we looked, one of the things we looked at is what do other states do? And are there any ideas that we could grab from other states that would have a limited actuarial cost, but also provide some ability? This one is probably particularly interesting for higher education because your retirees, they typically work longer than K-12. And when they're exiting your universities, they're at a higher age. So this would be to implement an age provision within the return to work structure. So retirees who, upon reaching the age of 65, there would be no impact to their benefit when they return to work. The waiting period would still apply. Of course, for all of these provisions where you're receiving a benefit, contributions are still paid, and that doesn't change from current law. But those retirees in any instance where your return as a retiree, unless you're getting a supplemental benefit later, they're eligible for a refund of those contributions. So this one is new, and we think in terms of data points, even on the K-12 side, there will be a large number of retirees who are currently in earnings limit provisions, for instance, substitute teaching, that type of work that will immediately fall within the age 65. Same thing, and maybe even more so, while higher ed doesn't have as much usage of the return to work law, we would think a lot of your retirees who may utilize this law would be in that at least age 65 provision, and or would give, you all options to bring people back for certain purposes that have reached that age to perform some of the functions that are needed. So the 50% the age 65, whereas this is a law where there's been limited usage from a higher ed perspective, primarily the 25% earnings limit, should really open up return to work to the extent that there is a need, and to the extent that there is a population out there to come and fulfill some of these, items that you need done, maybe short term, maybe small projects. This really should open some doors for higher ed in terms of the usage of return to work. So that's one big proposal. The next side, this is in here so you all can see all the proposals. This is really K-12. They have some critical shortage options. It's going to simplify that process for them. If we want to go to the next slide. So there is a provision in the TRSL return to work law, where, and this has been in place also for many, many years, when you return to work, whether it's by employment or by what we call contract, and what's been in the law is contract or corporate contract, that return to work umbrella you fall under it, and it applies. It is an area that is very difficult from the employer side to administer, very difficult from the TRSL side to administer. It's a necessary provision because, one of the things that is important from the actuarial side is you want to be sure that people can't do things indirectly that they can't do directly. So by throwing out a larger net, and that's where contract and corporate contract has come in, from the perspective of this law. So but what we're going to try to do, because, and I'm sure many of you that are on the HR side can attest to, it captures the HR side and the contracting side. And a lot of those don't always on a day-to-day basis have to talk. So if we go to the next slide, that gives you a picture where it's a lot more complex on the K-12 side, but the narrowing on the higher ed side would be to apply to reemployment through contract or corporate contract. If the return to work retiree is reemployed as a professor, an adjunct professor, an instructor, or a researcher. So a lot of those small contract pieces that happen, if they don't fall within the vein of these positions that you would 99% of the time otherwise be performed by an employee, they will be excluded from capture on the contract or corporate contract perspective. May not be as relevant to this group, but it gives you a picture of the whole, all of the proposals. So if we go to the next page, I'll go through the summary, and then I'll circle back to the two that I think are most, probably key for you all. So like you saw the big complicated chart in the very first slide, the distinction between when you retire goes away. So that's an element of simplification. Grandfather group, that's what the group that, was pulled in 2010. We're going to leave them alone. 12-month waiting period remains because that's essential from the actuarial side. And then increasing the earnings limit to 50% of final average comp. I'm sorry, one more, retain the ability to earn a supplemental benefit. We think that's important. The two pieces that I think are most critical to you all are increasing the earnings limit to 50% of the final average compensation, and then adding the age 65 provision. Those I think are the two. And of course, from the K-12 side, simplifying critical shortage. Adult ed on the K-12 side came up as something that the desire was for that to be covered, and then refining the contract or corporate contract provision. So that's really it in a nutshell. If we go to the next slide, and we can go to the next slide, you see the next steps, we can circle back to the summary and I can answer any questions. But, our goal is to actually get the draft out to the group probably today, get it to Senator Price by late November. And then if we expect there will be a bill related to it. And then the deadlines for retirement bills just gives you a sense of the timeline that this this proposal would be on from a potential 26 legislative session perspective. If we want to go back to the summary page, prior page, I know I kind of went through that quickly, but I'm happy to answer any questions that you all may have. All right.
Thank you very much
Thank you.
for bringing this
Absolutely.
to us. All right, so with this information, we will move into the discussion of the recommendations that we spoke about at our previous meeting. With the initial recommendation that each system shall develop a phased retirement policy dependent upon their system needs. The systems shall determine and define those needs as related to their respective institutions. And enrollment in the program shall be entirely voluntary. So this is just a general language recommendation.
So the first shall means we have to draft the policy, but could a system decide that they will not do phased retirement?
Correct. I think if we do it for one, we need to do it for all four. So there needs to be a policy that each of your systems put together. But at the end of the day, your management board has the right to vote yes or no as to implementing that, the policy. So the power always rests with your management board. Do we feel comfortable with this type of language?
I think so.
Any concerns?
All right, so what the general guardrails that we discussed at the previous meeting look like this. Each policy shall include the following: the definition of enrollee. I know that there was a lot of back and forth as to what that, who should be included, whether it's faculty and or staff. I think many of us, or many of the task force members felt that full-time faculty without designation of tenure would be the best choice, but I know that some systems wanted to also include unclassified staff personnel. So that would be at the discretion of the system. So either way, what that definition of what your enrollee looks like needs to be defined within your policy as how it relates to your system needs. The length of enrollment shall be no shorter than 12 months and no longer than 36 months. It was agreed upon that we should do no more than 3 years. No shorter than a year. Oh,
My recollection from the conversation was that it was 12 months and then it would be reconsidered at the end of each year. Is that part of this still, or?
I'm happy to include that language. That would be at the discretion of each system to
Wait,
note that.
I guess my question is, would that be mandatory that it would have to be revisited, or could you enter for a 3-year period and say this is gonna happen for 3 years? Because that impacts I'm asking because it impacts how I would consider
Right.
behavioral changes from an actuarial perspective,
Sure.
right? So.
I open that up to conversation as to how we like to augment that wording. If we want to say to be revisited after each 12-month period for a period no longer than 36 months total, I'm happy to.
I
to
don't think
include
that's
that.
necessary. If we enter into a 3-year contract, I think we don't need to revisit it every year.
Okay,
I think that's a large burden on administration to have to revisit.
okay.
So what if it's not working?
Like, since your agreement,
Okay,
There's an out.
agreement at
If
some
they're
point,
not fulfilling their obligations.
right, exactly. There has to be language in that agreement or an opt-out.
okay, all right, so I'm sorry, are we good with the 12 months, no longer than 36 months language?
There would be no extension beyond the 36 months. Thank you.
Correct.
They signed up for 36 months because they decided to leave early.
Yes. I would give them the option to opt out, give us the option to opt out.
Okay.
Do we need to implicitly say no extension?
I'm happy to, yes, I will include that language where it may choose to opt out. No extension after 36 months. Okay, there's been a ask of me to revisit the definition of enrollee as it relates to faculty and unclassified staff member. Desiree?
Yeah, I am concerned that we leave the discretion to the system whether they include unclassified staff members. I think that it just should be, it should say full-time faculty and unclassified staff members. I mean, yeah. I don't think we should exclude.
I think that should be a system call. So if one system doesn't want to, you're gonna say you have to have them both or nothing, then you're probably gonna get a lot of nothing. So I think it should be up to the individual system to make that decision.
What if someone changes systems? How does their year counts go?
That we talked about last time, right? That's
Right.
not, that have to be consecutive, it just had to be,
Within,
yeah. And
Yeah,
that's,
that's-
you might have.
Collective, there's
Yeah,
never
collective.
collective later on, right?
correct.
So collective could be across multiple systems.
Correct, but the determination of, if you are, if you've spent 25 years at LSU and now you're gonna spend your last 10 at LCTCS, how you choose the phased retirement program that you would be enrolled in would be the LCTCS phased retirement. If you are at LSU for 25 years and now you're moving to LCTCS for your final 3 years before you choose to retire, that would be part, you would fall under the LCTCS.
You might want to specify that it's higher ed. Because if you're just writing service, it could be interpreted as TRSL eligible.
Okay,
And the good news is it has to be agreed to by both parties, so somebody comes over working 20 years and another system comes to LSU for 1 year. We don't have to give it to, we'd say we don't agree that.
that is at the discretion of the system.
These systems policy gonna determine what level that decision is made at?
Yes, so if you see, under the fourth bullet where it starts with MOU, the system shall determine who signs off on the MOU, but shall include at least an HR officer, an academic officer, and a fiscal officer. So whom is the final decision maker? That needs to rest within a system decision. I noted that because it's very different for our 2-year institutions than for our flagship institution.
But it sets a threshold and then.
Correct.
Added.
Correct, yes. That's why I put at least.
Mhm, yeah.
Should there be a decision to include more, that would be at the discretion of each system. So it may be an easier lift for LSU Eunice than Health Science Center Shreveport.
We're back on that first bullet about the population.
Correct.
Other
So,
thoughts?
I mean, again, the reason why I put the latter at the discretion of the system, it does provide the flexibility for each system to determine what their needs are. Many of our systems define their faculty and staff slightly different as to how they're recognized within the MSAL. Librarians at one institution may be considered staff, while librarians at another institution may be considered faculty. So it does come down to a system definition. So,
I think I would lean toward leaving it at the discretion so that there is that, that's just my perspective on it. But very good discussion. Others, are we okay
I'm okay.
as a group with leaving it as it stated? Okay,
All right.
thank you.
Okay, moving to the third bullet, and then we're moving around a bit. Persons enrolled must have a minimum of 10 years of collective service, not necessarily consecutive, without refund of retirement contributions, and the age of enrollee shall be no less than 59.5 years. Are we comfortable with this guardrail?
Did I understand right, like 10 years of collective service in higher ed,
Yes.
right?
In higher education, yeah.
I think there should be some language.
I think so,
stating
just
that.
because
Yeah.
coming
Okay.
from a K-12 system and now I'm in the higher ed system, just to clarify that.
In a public
So
higher education system. Yes, sir.
I have a question with regard to that age of 59 and up,
Yes, sir.
because some faculty, when they serve over 30 years, they start, early, like the 20s, right?
Correct.
So I don't understand why you put an age in 59 and up.
So I'll defer to our HR team members in the room, but the reasoning for the 59.5 is that it coincides with some IRS designation and requirements as that in that. So that way it makes it similar to some of the federal determination.
I think that's how we came up with that.
That was my understanding as well.
So I want to go back to collective service in higher ed.
Yes.
So what are the other guardrails there in higher ed in Louisiana? In higher ed in one of the 4 systems? I mean,
Yes, it would have to be within public higher education in a Louisiana public higher education system. So it would not include Tulane or any of our private institutions, because statutorily we cannot dictate to our private institution as such.
is it helpful to state that here? I mean, it's in statute obviously.
It is, but I'm always happy to include additional verbiage. That's not a problem.
Can we add that they have to meet TRSL? Retirement eligibility?
Sure.
Yeah, somewhere along the way, we did talk about that.
Yeah.
You could have somebody that's 3 years short. If they
May
go in
have it in a
phase,
different slide, so I do just want to put that up, but if I don't,
yes,
please make sure. Okay, I'm sorry, Trey.
I wouldn't want someone who's 3 years short to think I have this 3-year phased retirement.
Sure.
If they don't have enough earnings to get a full year each time, 3 years could come up and they're not eligible to retire at all. So
Yeah.
safer to make sure they're eligible in the front.
Okay. All right. Any other comments as it pertains to the third bullet? Right, the fourth bullet goes into the MOU and what that would look like. You'll see here, it talks about who shall sign off, what the workload amount should be, and dual employment is prohibited during phased retirement enrollment. Formal acknowledgement is to be required. That might be.
How is dual enrollment defined? Dual enrollment in higher education?
Employment. I had to check myself too. It's employment. You said enrollment.
Oh. Dual employment. So how it's dual employment. related to
Right.
retirement enrollment. So-
Exactly. I believe the conversation circled around being employed within 2 systems.
So one could be
dual
employed
employment-
outside of one of the 4 systems.
I mean, I'm gonna,
Does it need to be TRSL?
TRSL.
Yeah, I think it has to be specific
I
to.
mentioned going work for a school board
Carousel.
last week.
Correct. So they can't go teach at, or do adjunct work, I guess, it's or, well, I don't know if adjunct would be a good one. Or do any type of part-time, full-time work with a K-12 institution and also do phased retirement at Northwestern. So that would not be an option. So we will need to add that language to clarify
I think
accordingly.
it's a good point. Because does that include consulting or?
Correct.
It's only what we can control.
Right, they can go work at Exxon, not the TRSL retirement plan. While transitioning out of teaching welding at any of our two-year institutions.
What would the wording? What are you noting the word?
Equal employment in an PRSL eligible position.
Yep.
Okay, that's,
Yeah, I put within a TRSL employment position, so.
okay.
Fine.
All right. Any issue?
Are there any other guardrails that you feel would be appropriate within the MOU? I will say. Noting that our four systems do have very different actors, you know, and needs. I didn't want to be too restrictive, but also not being while also ensuring that the guardrails are appropriate. There's certainly, I think, the option for additional guardrails should the system feel that that is in their best interest.
And we're just aiming this at TRSL, just saying back in the day, I could have went into lasers.
And you chose wisely, according to Trey, that you went into TRSL.
But I'm just saying, I mean, everything we're talking about is that there could be others.
Well,
I
it
mean,
would
that
be
would- I
either
don't know,
lasers or
restricted and
TRSL.
Classified to going in that.
If you let unclassified staff, there are unclassified staff that are in lasers.
Yeah. So we would need to.
That's,
would
I mean,
need
we
to
keep saying
include-
TRSL eligible, so we
Sure.
might wanna say TRSL lasers eligible.
Okay, state retirement system.
The state retirement
Yeah,
system
yeah.
eligibility, okay? State retirement program. Okay,
Those are defined in the retirement law, so it's clear what that means.
yeah, and I'll include the statutes for reference. Okay. And the final bullet, faculty may be rehired at full or part-time, but only following a defined period of time after the end of the phased enrollment. This goes to, there was a conversation that they may be rehired at full or part-time following a year period of time. So I kept that vague if you wanted to do more than a year or if you wanted to do a single year. Comments or concerns as it relates to that bullet?
You might need to say faculty and staff if the system decides to offer it to
Yeah.
staff.
My biggest question is how does this entire period interact with the 12-month requirement for return to work? Right, are you considered retired? From a PRSL perspective, once you enter phased retirement, or maybe that's not a question for this work group, it's a question for how the law is potentially drafted or how it all interacts, but
It would depend on how the law is drafted, but I guess what does the group want it to be? You want to be considered, I think you want to keep your insurance, you should
Right.
not. If part of the consideration is we want them to still be treated as if they're full-time, so they get all their benefits. Then we would not want them to be treated. Retired.
Correct. And that was a goal that was specifically stated.
So I mean, would this be similar to a drop participant?
Somewhat, except for, drop your benefits being paid into an account, not to the person, but yes, but other than that, I
That's
think it would
kind
be
of how
similar.
I think it would work.
Yeah.
Right, so these were the general guardrails as it pertains to this portion of the phased retirement program and move on into the next bullets that we were required to discuss.
Yes.
The time period for implementation of potential phased retirement program, it seemed to be a consensus that the systems management boards would need to approve the policy no later than June 30th to allow for effect of said policy by July 1st. This provides a good amount of time for everybody to do what needs to be done in order for it to be approved, whether it's set up your own task force at each of your systems or, however that needs to look. Did we have any issues with this timing? Does this work for everybody? Okay. I'm Schultz.
Rob.
Oh, another one. Okay, so the next one is salary and retirement benefits to be received during phased retirement. Enrolled participants shall receive a portion of their retirement benefits based on the system's defined percent of effort defined as not less than 50%. Enrolled participants shall retain full-time employment status in order to maintain health insurance. Enrolled participants' salary shall remain static during their time in the program. And once enrolled, participants shall not accrue leave. Were there any issues or concerns?
So for the third bullet,
Yes.
speaking of recent situations, for staff,
Mhm.
what if there are furloughs during their time in the program? Does the base salary remain the same, or is it a furloughed salary if there are furloughs for all staff?
We can include the language base salary shall remain static
I think.
to clarify
we should.
that.
So,
Question on that one. How about, change the cost of living in that period? Or person who is on that program is not eligible for any adjustment?
That was part of the discussion to be cost effective and cost aware. Which is one of the purposes behind doing a phased retirement program. So it's especially pertinent if you are also hiring someone else at the same time to allow for that information exchange. So this way, the fiscal members of the task force were thinking that it would cut down on some additional costs that may change during that time period.
So the first bullet, I think, works with a defined benefit plan. What about for?
Well, if I,
Typically, they either have access to all of their money
or
or
they
they don't.
don't have access to all of their money. If I recall, I thought we talked about how they do have access to their money.
They would need a separate
So-
quote, because there's no way to determine a portion because their account balance changes. over
Based
time.
on, sure. Okay.
Gina, you reference drop. Is the static, how does, from a comparison point, what happens at drop?
In terms of the salary.
Drop salary
Don't get
remains
salary.
flat, they would receive it. I'm just referenced drop before, so.
Yeah, so I mean, they get the salary increase, but their benefits already.
Phrases, yeah, in this case. It's reversed.
And when we talked about like the opt out of the phased retirement. If they opt out, they're leaving the system. They can't opt out and then take advantage of any salary increase if they go back, right?
Correct. That's that was my takeaway during our conversation.
And about accrued leave. If you can't accrue leave when you're in the program, how does that work? In terms of what you get when you get your accrued leave. Based for faculty, is that based upon the last year? And then
That
the
was-
last year you don't get any,
Correct.
then does that extend? Does that make sense?
It does make sense. I mean, however, this was language that y'all had seemed to lean toward, but I am open to changing it and determining how that works with
Don't
through both
recall
PRSL.
Me either.
I was thinking that they would get it.
Okay.
I don't know how we got to not getting them.
Can check the minutes again.
Tom.
That's okay. If you are, if this is, I mean, if they shall accrue leave, I think there was, you know. Are we accruing sick leave? Are we accruing vacation leave? Are we not accruing? You know, do faculty accrue leave? Do they not accrue leave right now as full-time employees? I'm happy to change the language to reflect whatever is the general consensus.
Coming from the faculty side, not the HR side, but if you're not accruing leave in those 3 years, then for example, you couldn't use like FMLA. Right, use your sick leave, right? So that I think would be problematic in those 3 periods, because essentially you're giving up the ability to use that and then use your sick leave to compensate for it. So I would lean towards using it, and also faculty on 12-month contracts should get annual leave to then offset other obligations they may have, right?
Yep.
So
Yep.
I would think it would be beneficial to accrue, although I can understand the cash out concern at the end with the
Okay.
accrued annual leave. And so I don't know,
Okay.
maybe that was the motivation for saying you can't accrue it, but I would think it would be in the interest to be able to accrue it for those reasons.
What if it came across because of somebody working less than 50% doesn't accrue? I wonder if that's how it came in the conversation. I just don't recall it.
Have to reference where it came up, but
It would seem to me they should,
happy to change it.
it would seem to me they should accrue based on the eligibility of the percentage of
Yeah.
their work effort.
Okay.
Whatever that, how, you know, what like you referenced there. So that it's anchored to something, yeah. Me too.
Okay. The one enrolled participant shall continue to accrue leave based on their work efforts.
Yeah.
Okay.
So I'm assuming we're not. Gina, paying termination pay until they're out.
All right, next. Potential of providing additional lifetime income. And if you think, I also should have noted, if you think these bullets are more appropriate to a different requirement within the HR, just let me know. Can easily move the recommendations as noted. Enrolled participants may receive a percentage of their contribution to annuity consistent with reduction of workload percentage. Contributions made to the participants' DB retirement plan, and I'll be specific in stating Louisiana State Retirement Plan, shall continue upon enrollment but be prorated based on workload adjustment. And enrolled participants may continue to contribute to their supplemental retirement. Any changes? Did I miss anything?
Or people just contribute to their ORP.
I believe that's what we said, that they would be able to continue to do as well, yes.
What's that first bullet mean there?
Not the same.
Percentage of their contribution to annuity consistent with reduction of workload percentage. Oh, I'll have to check my notes.
How do you think?
That's supposed to, I guess, refer to, they're gonna keep contributing, but they're not gonna earn any more service credits. So is that them getting their contributions back? Contributions to the DB plan? Funded at the end, might be what that's.
You're
They're gonna keep
referencing our
contributing,
minutes.
but they're not gonna earn service credit. They need to be able to get those contributions back.
Okay. Yep. It's within our minute, so, page 5 is where I got the language from. So what, to ensure that it is made clear, we need to change. Yeah.
So help on the word. Appreciate it.
That was the one y'all didn't have many comments from the task force. Or y'all didn't have any comments regarding the lifetime income. Based on. When Kelly and I looked
bottom.
in again.
Yeah, it's point number 7 at the
Yeah.
bottom of page 5, and it goes into page 6. Is it related to that point F, I guess, primarily, the ORP reference? First bullet. Needing clarification on slide 11, the first bullet. And I think it perhaps relates to the first point F at the top of page 6, right?
I don't.
We can fully
Is it? I mean, you can put that, I understand that they can annuitize their ORP account at any time. Well, then they gotta be a certain age, right? But,
Correct.
but I don't know what that, I mean, this seems like we would give them money of the retirement benefit the employer was paying. To an annuity, which I don't think we are paying anything to an annuity.
I feel like the point F may have just been a statement of fact in the discussion, and then perhaps the first bullet is not needed. Because there's no action, I don't see where. Does anyone disagree with that? Okay. So
Alright,
you want to
remove.
try
Yeah.
first bullet.
I have a question about language. So at
Sure.
some point, will Luma or someone else go through this and look at words like may, can, could,
Shall.
should, and regularize all that?
So shall, they all mean different things within,
Right.
Statutory, relation. Most of them, will be reflective of what the task force wants. So if the task force chooses to use the word shall, then we can include that. At the end of the day, it is at the discretion of Rep. Bakala as to how he will go forward.
So someone
his
goes through
recommendation.
and makes those decisions. And I'm just looking at that, the point F that you just mentioned. Mark. currently have the ability, compared to that third bullet point on slide 11, may continue to contribute. I'm just thinking about language there.
Sure. And I'm happy to change everything from shall to may. If that's the will of the task force, and then, yeah. Brett Barclay will have, or whomever chooses to move forward with the legislation
Flexibility.
will have
Right.
the opportunity to change that at his discretion.
We need to add a bullet for the ORP. It says you can contributions to the DB will continue. Do we need to say that?
Yeah. I
You're gonna-
noted, I have a little note on my thing that we need one for ORP participants. Yes.
So any comments from the group on the discussion about shall and may?
It's
think-
fine, and the legislation could.
Yeah.
determine that.
Sure.
He's gonna have to feel strongly enough about it.
Correct.
He
To-
right shall.
You
he
know,
right may.
exactly.
It is
That
it
provides
is at the
flexibility.
discretion of the author of the bill at the end of the day,
Yeah,
Correct.
how they choose to take our recommendation.
I think the decision is we shall. have
Change it
may.
all to may.
I think
Easy enough.
we need to say shall.
I agree. There's that it's
I
applicable.
think. We say you shall keep contributing, then
You must.
you or have to keep contributing. Supplemental retirement plans, just by their nature, voluntary.
Yeah.
Yep.
Correct.
Just, to me, we're saying, if you choose to do it, you can still do it.
Yep.
That one shouldn't be a shall because it's a voluntary program.
So it should be may.
Yep, yeah, number 2.
Going back to that. Participant in the DB state retirement plan shall continue. You mentioned that they wouldn't get any service years. So why are they contributing if they're not getting more service years?
It's just like, it's basically the same way it works for, return to work retirees. It's capturing that portion of it's capturing their pay for purposes of funding the system.
So they've already put their pay in there to fund the system. If we're gonna say you're not in that, I didn't know until you mentioned that they're not gonna get any more years. I thought they were gonna get the years prorated. If they're doing 50% over 3 years, you get a year and a half. But I don't know why they would continue to pay into that. They don't when they go into drop, right?
Correct.
So why would we require them to do it in this? I don't think that's fair that continue to make them pay into a system
Well, they
that
have
that's
to-
gonna benefit them.
They have to pay into something, so unless you want to put them in social security while they're,
Yeah, I'm okay with putting them in the system, but they should earn those year, credits for the years that they're in. See what I'm saying?
One of the earlier meetings, we talked about ending their defined benefit accrual when they entered phased retirement.
Okay, so then I don't think they should continue to contribute to something that's not gonna be to the benefit of them. So I understand running the system, but that's
Well,
not,
they also have to contribute somewhere.
yeah, that's what I'm saying, that's why maybe we should turn it to, okay, then they contribute to a supplemental plan.
But a drop participant doesn't contribute to anything.
So, and so I'm not sure what's the
Yeah.
difference. I mean, I know our money that the employer is putting up goes into a fund that they get a cash out or do whatever with once they leave, but employee,
And they'll get a refund of their employee contributions. But it's not going into the system and never coming back, then they will get it
They
back
get it back.
because there's no supplemental benefit that's being earned.
that's on the drop, but this.
Right, no, that one, well, that was the point that
Get
Trey made earlier.
their return.
Yeah, so return to work retirees,
They get it.
they get money back, and that probably needs to be added, and Trey made that point earlier. That language should be in there, that you get refund of your contributions at the end.
Yeah, I would be okay with, as long as they got it back.
Other benefit back.
But again, why are they required to make a payment if they're not doing that in the drop? What's the difference?
Didn't we decide, or there was a conversation about only a contribution plan once they entered phased?
Yeah, the supplemental, the
I-
403B and
think we need to really determine, do we administer this like drop or do we administer this like a return to work? I think that that's where we're flopping, and I think it's gonna be difficult to manage if we don't use it.
Similar to drop, I would think, because you haven't yet tired. So if we want to treat it like drop, then
I think it's
the
much more
employee would
similar.
not contribute during their phased.
So, let's say similar to drop,
Pull the same language.
may participate in supplemental or no?
Yeah, they can still do
Yes.
supplemental.
So it could,
That's a whole different.
right, so
Yep.
it could be may participate in
So-
supplemental, but they don't have to.
So we want to have a different rule for DB and the ORP. We want the ORP people to still be able to put money in their ORP account.
Right.
You say may, not shall.
Then I didn't take out shall.
Yeah,
Oh, Mayor, you took out shall.
yeah,
I mean, you say.
Right.
Well, so if we say that the employee doesn't contribute during this time period, are you hurting the ORP people by not letting them put additional funds in their ORP
and
account?
they should be able to.
So it's, if we want to say, no employee contributions to the DB plan during paid retirement. Then
But they still have the option of supplemental, which is,
That's what I'm kind of thinking
Yeah.
too. So then they don't contribute to the ORP, they contribute to their supplemental. And then
if they contribute to the
treated-
ORP, they would get their employer contribution as well, whereas I don't know how the supplemental
Yeah.
works.
Yeah.
so that's what I was asking on the employer side, are you gonna treat the defined benefit different than the ORP? And that they're not gonna get the employer contribution? But the ORP would. So, I mean, I think it's, they got,
Well, if we treat it like drop, the employer portion still comes in.
but it goes into an account that then goes back to the employee, right?
No,
The employer goes into the trust. The,
So the employee portion goes into the drop account, not the employer?
no, there is no employee contribution for drop. Their retirement benefit goes into the drop account. So on paper, they're treated as if they're.
Oh, I
retired,
got you, yeah.
And that money goes in.
So the employer is still making a payment on their behalf that's just going into the system. I don't know, other thing. I know.
Stay focused on it.
That's it.
Line of rabbit holes.
but I guess the question is, we want to treat everyone the same. ORP and DB, and then just. It's a question.
Yeah. The will of the task force. I'm just here to write the language that y'all need me to write. I have no voting.
Okay, so anybody can tell me no. So defined benefit, treat them like drop, no contributions in by the employee. ORP, allow them to contribute. They want to.
But on both sides, the employer is still contributing.
Right.
So wouldn't, for supplemental, wouldn't they have to have 5 years to receive benefits for supplemental purposes? We're limiting 3 years for the plan.
The supplemental is just your own account
Okay, I was
and there's
thinking
no
that.
employer portion to it.
So like when you come out of drop, you start to contribute to the defined benefit plan again. So, and.
So you start earning a supplement right away. The length of time you work may impact final average compensation that you use to calculate the supplement. But if you work past the end of your drop, you start accruing the supplement.
Gina, can you say the first
piece again, did you say was a birth goal?
Those who are in a defined benefit plan would be treated like drop. There would be no contribution by the employee.
They're not
The
allowed.
contributions would continue by the employer.
So let's talk about people in ORP. Where's the employer funding going?
What is the
Going into their
employer?
It
ORP
goes to the ORP
ORP.
person.
Goes into
without
their,
them putting anything in?
No, they
No,
have,
they
you have
are.
to, yeah, you have to put it.
So how does an ORP person? They're not doing drops, so that we can come up with whatever we want to.
Correct.
I think that's because there is no,
Right, there's no tool.
there's no drop rule to apply to them, so it's really just the group deciding how do we want to treat
The
ORP
ORP
people in this case. There's no equivalent drop rules to apply to.
So the current proposal on the table, again, let's talk that through and see if there are issues or concerns.
well, it would be, I think we're fine with those persons who are enrolled in the Louisiana State Retirement Plan. It would be similar to drop with no contribution by employee. The issue at hand is more, how are we determining how the ORP members will continue? Or do that. Yeah. A little impossible.
So it's just trying to work my head around this, what would be the incentive to participate, right? If you're an ORP person and you can't contribute during this period. Essentially, you would be retaining those funds, you'd be losing the 6.2% employer match or whatever the employer
Right.
match is, right?
Right.
So if you want to get that 6.2%, you wouldn't do this because you would say, well, do my extra 3 years at regular employment. So it seemed like you would want to allow them to do that to get the 6.2. I guess the question would be, is it required that they do that? I would think probably, because you want to keep it equitable between the phased retirement and the retirement, because you're not really retired, as we were saying, right? You're still employed, just at a lesser effort. So I would think probably keep the contributions during the phased retirement plan. If you don't want to contribute, retire. If you, like, yeah, I mean, and so I'm just thinking, putting myself in the position of someone on the ORP, I think the extra benefit of the employer contribution over that period would outweigh any sort of equity issues between the DB and the drop.
Go with that?
Right.
Yes.
Thank you.
I'll fix the language. Right. All right, okay. Next one. Okay, so this one I flushed out a bit. We stated that it would essentially be the same as previous, but would be contingent on retaining any dollars that are received from any type of payment. So in this one, you can see the language has been changed to strongly recommended as opposed to as opposed to requirement within recommendation 1. So to ensure equitable and competitive retirement benefits for Louisiana's public employees, it is strongly recommended that each public higher education system establish a minimum employer contribution rate equal to the employee's required contribution of 8%. That's not saying you have to, just saying it'd be really nice. All other language remains the same with recommendation 2 and updates to reflect the new constitutional amendment being passed. That is now Act 222 of the regular session, as well as the change in date, which has moved from April to May per Act 1 of the 2025 extraordinary session. Within the first bullet, it says it is recommended that the establishment of requiring an increase to 8% subsequently by the systems be contingent on retaining a minimum of 13 million from the recognized savings of the 81 million currently estimated in the higher education budget, thereby allowing these savings be used by institutions to increase employer contributions to ORP accounts. And then the second bullet is that shall this contingency be met, it is recommended that a subsequent action of amending the statute be made to establish a required minimum employer contribution rate equal to the employee's required contribution of 8%. So the first recommendation is saying, we're strongly recommending this happen. The second recommendation is saying, if the constitutional amendment passes, then 13 million, we are saying 13 million needs to remain within the higher education budget to cover the costs of a subsequent required increase to 8%.
So we're making a recommendation and we're providing a funding option.
Correct,
For the second one.
for the second one.
Yes.
Yes, the first one is just a strong recommendation, saying.
But
if
we
system
already
pro-
have the ability to do that, correct?
You do already have the ability to do that. This is just saying, we strongly recommend that you do that, Tom.
We could change it to just change the statute now and say 8%, Tom.
As long as you like furloughs and layoffs.
Which is what the prior recommendation said. We, one of our, here at the Board of Regents is, we are very mindful of the budgets of our higher education systems. And we are respectful of the needs of each of the systems and institutions. And so our argument is that if we put forth something that has a cost related to it, then there has to be some type of contingency met in order to fund that cost. That is what recommendation 2 is moving toward. The language probably needs to be cleaned up a bit, but that is the purpose behind it.
So do we want to just link it to that passing? Or, I mean, in my mind, if they give us input, maybe they have some money left over and they're gonna prepay the UAL with that, not
Or
necessarily
other
this.
Or
I
So if that's a savings,
Be
they're able to give it,
Sure.
let us keep the savings of which they typically don't, they scoop from us. Or they give that to us and we're able to do that. So I don't know if linking it just to that.
That's fine.
I think
Like
that's
if they
fair.
would allow it, if they would give us money, maybe they would find it in their heart, find it somewhere in the budget, and they would give it to us. That we could do that, then yeah.
Okay.
All for it. I don't know if we necessarily want to just link it to that pass.
We can do a general legislative appropriated funding or appropriated legislative funding.
I mean, it could be
That's fine.
from this or
Sure,
anything else.
sure.
But I still think it should reference those.
Yes.
Yes. This and or other.
Mm-hmm,
creating funding.
appropriated, sure. All right. All right. And then this is the same situation of the contingency. Being that this is a general funding, so it's not specific to any type of funding coming in this one. For your previous question, shifting the total ORP administrative fee cost to employers shall be contingent on legislative funding. Shall this contingency not be met, the total ORP administrative fee cost will remain split between the employee and employer, with the employee cost not increasing past 50% of the total administrative cost, which is what it is going to be. Comfortable with this language?
So the entire cost is not shipped to the employee, is that right?
Correct, which occurred
Okay.
July 1st of 2026. Yep.
Okay, I would suggest that. How is this slide going to be used going forward? Is this slide going to appear to any other body? Because if so, I would suggest that the heading of the slide be changed. The heading suggests that the entire fee goes to the employer.
Right, so
I mean,
that,
goes to the,
that's that, the headings are reflecting what we were tasked to
Okay.
review as per HR
I see, okay,
143.
okay.
So that is
Okay.
why the heading is stated as such.
Good.
And last but not least, The potential cost of providing greater payout by using accrued leave to enhance a participant benefit. Or P, participants shall be paid up to 600 hours of accrued leave. The current payout amount is 500 hours, is what was discussed. There has been one of the items that one of our task members brought up is that this is not necessarily something that would be the will of each system because of the additional cost of the 100 hours of accrued leave. So I now open this up for more general conversation. We can certainly put a contingency of funding support on this one as well. Should that be the
Nikki
will of the
ran some
task?
numbers for A&M. And they're between 230, looking at the last 3 years, 25, 24, and 23. And it's between 230 to 280.
Thousand. Okay,
By going, by allowing them, she looked at everybody with leave balances.
Sure.
More than
sure.
what we currently give. So those additional payments would 270, like I said, 280 to 230
Okay,
over the last 3 years.
okay. So it would be an additional cost of 300,000 to the flag.
I mean, the most recent year is 230. So it's like, it depends, obviously, it depends on
Up
the
to,
stress, right?
sure.
Leaving.
Correct. I mean, it
Sure.
fluctuates all over.
Okay. So is this, do we feel comfortable changing it to 600 hours? Is that,
What's the other systems?
I think we're comfortable with it. Okay. We really don't have a large number of ORP participants. So like our numbers are very minimal.
they only pay out like 25,000 at LCTCS, so it's not. No, I have no idea. I'm sorry, Gina.
I didn't pull the numbers, but we don't have very many ORP participants to begin with.
Mhm.
So just the sheer number
Okay,
is minimal.
right, what is the will of the UL system?
I guess it's okay, as long as there's a limitation. There is.
I agree.
Okay. All right.
Good.
Any other comments or concerns as it relates to this recommendation?
So Elizabeth, read the statute on leave payout.
Yeah.
You might want.
Yeah, I'll have to reference the statute. Okay. And look at that. So I know we talked about at the last meeting that we would potentially need a December meeting. I sent out, I did not confirm anything because it was all over the place. So if we feel comfortable, I can go ahead and set up another meeting for December and provide you what those potential dates are. Again, one of the dates that was not included was Tuesday, December 9th, which some of the boards changed when they were meeting. So the initial calendar said one date, LCTCS changed their date of meetings. So that is why we cannot meet on the third as I had initially provided. So if there's the will of the task force for for review of the final recommendations and approved language to approve the final language as well. We can meet at a time on the 9th, if that works better for task force group as a whole.
And just walk us through, so at that meeting, we would have
You would
the
have,
actual document.
correct, you would have the final document.
And
Yeah.
we would receive that in advance, so we can review it in advance.
Yes. Yes.
Returning back SAGs.
Okay, so that's,
So our
let's see.
original board date was the 10th. Was that one of the days you sent out?
Of the 11th, yeah, the 11th, the 10th or 11th, yes, but the 10th is LSU,
11th.
the 11th, y'all are the 11th.
They could change it, but that's what I.
Right, okay, well then ULS is also on the 11th. So the 10th, 11th, the 3rd. Our no-goes, the 10th is Board of Regents board meeting as well, and I don't think Southern is meeting in December, or are
Yeah.
y'all?
We
Okay.
are- We normally don't.
Okay. That's why I didn't have it on my thing. Okay, so the 19th would be, that's late, you know, I apologize.
Great.
Okay,
Yeah.
so the 19th is not an option as well. So I have the 9th. At any time during the day seems to be the best for all members. Or for all systems, except for the staff.
Yeah.
Are you flying in the morning? We can have it in the afternoon.
Yeah.
About 16.
You're excited.
Wait, I'm not in SACs, but we're in, I'm faculty, so that's our exam week.
Yeah, that was the other thing. Cause everybody goes home after exams, so I was trying to be cognizant as well of that. Board of Regents continues to work until forever. But we can meet, the 16th is fine if y'all would like to move it back to that time. For our faculty in the room. I know staff.
I
don't
would rather
have-
that than
Okay.
having to not be there for.
That-
Any issues with the 16th?
That's perfectly fine. Okay, all right.
Elizabeth, I need
Yes, sir.
to clarify something. So for drop, I've been told that the employer does not contribute during drop.
I was gonna say that. That was.
Okay. All right.
So we're going to treat it the same in days. It would be for an employee, either way.
So,
So the option would be advantage that contribute to the supplemental if they wanted to continue.
they would need to just simply do a
Because that's the
supplemental
same.
as opposed
Like
to.
they're not contributing.
Okay.
So there's no issues with social security.
So we're back on slide 11. just
Yes.
For
Yep.
tracking purposes. So with that late breaking news. You will change to
I will change to
participate.
correct, may
Supplement.
continue to contribute. May participate and or continue to contribute to their supplementary time.
Yes, we would contribute. The defined benefit or the or.
But they are.
I would think they are contributing to their ORP. I don't know how that
So
would
the
change.
employer is then gonna continue to contribute on behalf of the ORP, but not for the defined benefit.
That's what I understood.
Yeah, I mean, I think,
That went to what Dr. Tyrone stated.
I mean, I think it made sense to continue the ORP contributions to get the employer match on the drop, even though you're not getting it, right? It seemed like the employer match or the employer contribution was less of an issue because it wasn't going to get.
Now, I understand it's a little unlevel for the defined benefit. I mean, I
I want people.
know, I mean, I'm just saying that.
Another closet that we're.
We need to have drinks.
I understand, believe me, I understand 30 years of ORP. I know. I mean, I'm okay with that. We just need to make sure we define that the employer won't contribute on.
I
Fine
do, I
benefit.
do think if we don't allow them to do it, then they won't choose this at all.
Sure.
I would agree with that.
Okay.
Am I? Part-time.
Alright.
I just wanted to make sure we understand
Yeah.
this. Which, no, there is.
Yeah.
already. Gonna get working on that, and get that money, get it at that eight.
Positive thinking. Okay, so with, do we need to go back to any of the other slides before? Right,
I believe so.
okay,
We
well,
can move to other business.
We
Any other
can.
business?
I will be sending out an invite for December the 16th from 10 to noon in this meeting room. So the final, for our final meeting.
Okay. All right, so is there any other business?
I just wanted, I know I'm actually going to skip ahead, but I wanted to do this very quickly, is just to say a special thank you to my team within the human capital management staff here at Board of Regents. Carlita Anderson, who is our assistant commissioner and our lead here with our human resources team, Kelly Cormier, who is our human resources business partner, who is the person who diligently takes all of our notes and gets my early morning emails that says, I printed it all, just go put it in their spot, so they'll be fine, don't worry. Kim Small, who's our employee relations specialist, who pitch hits when Kelly or Carlita are out. And then we also have Ashley Prejean, who's not in this room, but she is a student intern. She is, I'll just do a little resume for her. Right now, she is a student at LSU and is wanting to go into HR. So for those of us in this room who might need a future employee within HR, Ashlyn is happy to and excited about going into HR. I know that might not be the case for some, but that is her choice. So
And
I
thank you
just
to the
wanted to skip
person
ahead.
that leads that team
Oh,
as well
oh.
and has led. all
I
of
am
our
only as
efforts.
good as my staff. I cannot succeed without each and every one of them.
We're talking as if we won't be together.
That's right.
So,
Well, I wasn't sure.
I
but
think you put
wanted-
that slide in there hoping, I mean,
know
you
what
still
that-
have 28 minutes to go make these edits. And then we come back and approve them. All right,
Thank
if we
you.
wanna do that.
I will 100% not do that.
Okay, I'm giving you the option.
Thank you.
Be done in November.
Thank you. But I
No,
did just
thank
want
you
to
for
skip
everything.
ahead before we adjourn, though,
Okay.
to make sure and do that.
All right, so I would need a motion. I would entertain a motion to adjourn.
Move we adjourn.
Bowler? The seconds? Any opposed? Everybody standing up, so I guess no. So we are adjourned. Thank you, everyone. Excellent conversation today. Good meeting, so it's good to see you. Good stuff.
30 years. It's supposed to be not, it didn't say anything.